What have been your biggest moments so far?
Um, so a lot of the using your study guide with the Murphy sign and Kerr sign, like those
Hmm.
were big, like the abdominal. I for some reason I had a lot of abdominal injury test questions, but they were very like vague, and it was I just could not remember for the life of me what organs were in what quadrant of the abdomen. But using your
Okay, so
study
tell me
guide,
which is which.
so like right upper quadrant, that's going to be like your Murphy sign if it's a liver or a gallbladder injury. Left upper quadrant would be your Kerr sign. It's going to go over to your left shoulder for your spleen injury.
Okay.
Uh, so like things like that, and then like right lower quadrant pain is like your pancreatitis from injury or swelling to your pancreas. Like I had all those questions, and for
Wait,
some reason,
hold on. You said right lower quadrant and you said pancreatitis. That's not how
yeah,
I would say it.
isn't it where you would have right lower quadrant pain? It could be your patient has pancreatitis.
So let's think about this. In your right lower quadrant, that's down here. What organ is the main thing that we're worried about here?
Appendix.
That's going to be appendix. So that's going to be more appendicitis.
Okay, so yeah, flip flop.
Pancreatitis, so your pancreas kind of sits here. Okay,
Okay,
so pancreatitis is
I
going
might have
to
just
be
mixed them up.
more pancreatitis is going to be more epigastric pain with radiation toward the back.
Okay,
Okay, pancreatitis more epigastric pain, radiation toward the back. Appendicitis is more right lower quadrant pain. What's the point that we use to figure out if they have rebound tenderness?
um,
So
mm,
let's say this is their hip and this is their belly button. So halfway
cannot think of
between
the word.
so this is the iliac crest and this is the umbilicus. So we're going to go about halfway between those two, and that point is going to be, what's that point?
I cannot think of the word. I was just studying this last night too. I cannot think of the word.
Okay, so that point right here, that's going to be McBurney's point. Okay, and so what we're doing is we're pressing down gently and then we let up to see, does it hurt when we let up?
Okay.
Okay, because if it hurts when we push, that's called tenderness. If it hurts when we let up, that's called rebound tenderness, and that's what we're looking for, is positive rebound tenderness. Okay, so the other thing, so appendicitis, we're looking for positive rebound tenderness, possibly positive fever, probably tachycardia, things like that, signs of sepsis. Okay.
Hmm.
The reason it's so life threatening is because you can dump all of this fecal material into the abdominal cavity very quickly. That can end up getting into, it can make its way into the bloodstream, now circulate, and now they have sepsis. Okay. So a ruptured appendix, like appendicitis that leads to a ruptured appendix, is a surgical emergency. They can die from septic shock. Okay.
Okay.
Okay. What if they have like a very rigid abdomen? Like if
Could be
their
like some,
abdomen is very hard, what is that more of a sign of?
um, could be either like internal bleeding or like,
Okay. So that probably could be some kind of massive internal bleeding. I would agree with that. What else could it indicate?
could it be like a peritonitis?
It is. So that would be like peritonitis. And what is peritonitis?
It's like the inflammation of the stomach lining,
Yeah,
I
but
think.
it's there's something irritating it. So typically there could be like some kind of pus or inflammation that's irritating the wall. And that's what's causing it to be so distended, because your body, your muscles start tensing up to kind of hopefully push some of it away.
Mhm.
But in turn, that's going to cause the abdomen to be distended or rigid. So we're looking for rigidity. So I say turds. So tenderness, uh, rigidity, or distension. Okay. So if they describe a patient with a tender, rigid, distended abdomen, or at least a rigid abdomen, we're thinking the two top things are going to be bleeding or a peritonitis. Okay. Okay. What if you have stuff spilling out of the guts? Like, what if you have an abdominal evisceration? How would you treat that?
You gotta cover it with like moist, sterile dressing and rapid transport.
Okay. Moist sterile dressing and what? Because moist keeps it wet, but you also want to keep
Exclusive.
it protected. So you want to also
Occlusive.
use some kind of occlusive dressing like plastic wrap.
Mhm.
And so sometimes ambulances will literally carry plastic wrap, like saran wrap, on your truck. Or you can take like the IV bag. You could, if you have nothing else, you could take like the bag that like a liter of saline comes in, and
Mhm.
just the part that's on the inside, that's, you don't want to use the outside and put it directly on the skin, but the part that's
Yeah.
on the inside, put that on the skin, cover it up with like silk tape on all sides. So moist sterile dressing first, and then the plastic wrap on top of it to seal it off from the outside
A
environment.
BVM bag. Most of the time, your BVMs come in a big bag. That works
Yeah,
well
BVM
too.
bag would work. It's actually a little more flexible also, because the IV bag is a little more stiff. So a BVM bag would work well. Yeah. Okay. So yeah, we covered care sign with referred left shoulder pain. Murphy sign, so that's typically going to be what organs over here? Well, it's going to be more here.
The gallbladder and the liver.
Yep, gallbladder or liver. Okay, let's talk about gallbladder situations. All right, so let's draw in a liver. So where's the liver located, by the way?
The right upper quadrant.
It's in the right upper quadrant below what? What's that big muscle what's this
The
big
diaphragm.
dome-shaped muscle? Diaphragm, okay. So the liver sits in the right upper quadrant just below the diaphragm. Okay. And then right below that is the gallbladder. Okay. Now, so with Murphy sign, we could have like when you press. So what is Murphy sign?
It's
Now
when you.
notice we have a McBurney and we have Murphy. Those are different. So in Murphy sign, what is the actual sign?
It's when you. If I remember right, it's when you palpate the right upper quadrant and they have a referred pain to their right shoulder from when you
Okay.
palpate the.
And it's primarily when you palpate on inspiration. You have them breathe in, and as you're pressing, and if as you're breathing in, as they're breathing in, they now have either pain here or pain to their right shoulder, that would be a positive Murphy sign. But it's
Okay.
palpation on inspiration.
Okay.
Okay. Now, what if they have a gallbladder problem? What are our options here? Okay. What if you have gallstones? What's that called? So if I put stones inside the gallbladder, then now I have gallstones. What's the word for that?
Drawing a
Okay.
blank on that one.
Okay. The word for stone is lith. Gall is chole. So if I put those together, it's going to be cholelithiasis.
Okay.
So cholelithiasis is gallstones. Now, what if I have inflammation of the gallbladder?
Cholecystitis.
Okay, so chole is gall, cyst is bladder, and itis is inflammation. So inflammation of the gallbladder is cholecystitis.
My wife just had that.
Okay. Cholecystitis is inflammation of the gallbladder. Cholelithiasis is gallstones. Now, what if you have a blockage of the common bile duct? So here, let's do it this way. Let's zoom in on this. So here's a gallbladder. Okay. And it feeds into the pancreas. Okay. Well, no, let's say it differently. The pancreas, this is your pancreas, and then your gallbladder, they come together in what's called the common bile duct. Okay? Common bile duct. So if I have inflammation of the gallbladder, what's that called again?
Cholecystitis.
Cholecystitis. If I have inflammation of the pancreas, what's that called?
Pancreatitis.
Pancreatitis. But what if I have inflammation of the or let's say I put a stone. Let's say I have a stone that starts off in the gallbladder. When it's there, it's called what?
Cholelithiasis.
Cholelithiasis. But what if this stone now gets wedged in the common bile duct? Okay, so think about it here. If I have this situation, now stuff can't drain from the gallbladder, so the gallbladder gets bigger. So now I have cholecystitis. But if things can't drain out of the pancreas, now the pancreas gets bigger. I have an obstruction in the pancreas that'll lead to pancreatitis. Okay? So if they describe a situation where you have inflammation of this and inflammation of this, it's probably an obstruction here. And that's going, you know what that's called? Where you have a gallstone in the common bile duct.
Something lith.
Okay. So this is going to be cholelithiasis. Okay.
Gotcha.
Chole, that's for gallbladder. Doco, common bile duct. Lith, stone. Asis, condition of. So choledocholithiasis is a stone in the common bile duct that will also lead to inflammation of the gallbladder, so cholecystitis, and inflammation of the pancreas, so pancreatitis. Okay?
Yep.
All right. Who gets this? Who is the patient who gets cholelithiasis primarily? It can happen to anybody, but the person who's higher likelihood of this is deep fried fatty foods.
Okay. I was going to say fatty foods.
Real quick, Joshua. I'm sorry. Another thing I just learned about this because my wife just dealt with this.
Yeah.
Is recent pregnancy.
Yes. And that's due
apparently
to
it affects
estrogen
like
surge.
80% of people after pregnancy because my wife just had to have her gallbladder removed because of this exact thing. Okay.
And it's due to the estrogen surge, like just due to the hormone fluctuation of estrogen. All right. Is this making sense?
Yeah.
Okay.
Yes.
So like he said, so recent pregnancy could be this. Deep fried fatty foods is a high likelihood, especially when it comes to the gallstones. All right. Pancreatitis. Who gets this? Who is your patient who has pancreatitis, chronic pancreatitis?
I don't know why I'm thinking like alcohol.
Okay, alcohol could be. It's. I don't think it's number one now. Number one is probably obesity.
Obesity.
And also estrogen. Okay, so obesity, high incidence of estrogen. Alcohol is probably a little further down the list now, but alcohol abuse, chronic alcohol abuse. How does this patient present? Where's their pain again for pancreatitis? Because where's the pancreas located? Well, the pancreas is here. So the pain is more epigastric pain. All right. So this is going to be epigastric pain with radiation where?
To the back.
With radiation toward the back. Okay. This is going to be your cholelithiasis or cholecystitis. This is going to be more, just because of where the gallbladder is, it's going to be more of the right upper quadrant, but it also may be worse after eating. Okay. Pancreatitis could also be worse after eating. Why? Because right after you eat, your pancreas has two jobs. You have an endocrine pancreas and you have an exocrine pancreas. The endocrine is what does the hormones. The endocrine part is what does your hormones. Remember, you have an alpha, beta, and delta. The alpha does what? So your endocrine pancreas does your hormones. You have alpha, beta, delta. Alpha makes what?
Mm.
Glucagon.
Glucagon,
Beta makes,
the insulin.
and delta makes somatostatin.
I cannot remember how to say that word for the life of me.
Okay,
Somatistat.
so but those are the endocrine jobs of the pancreas. These cells are your cells that make up the islets of Langerhans. Your alpha cells make glucagon, your beta cells make insulin, your delta cells make somatostatin. That's the endocrine job. But the pancreas also has an exocrine job. Exocrine. Okay? And the exocrine job is what makes digestive enzymes. So the reason pancreatitis can also happen, or they have pain after eating, is because after you eat, now your pancreas has to start secreting more enzymes to help digest your food. Okay, so both of these things could be a pain that's worse after eating. Okay. Okay, nice. Okay, spleen. Let's talk about the spleen for a second. What's the job of the spleen?
God, I forget.
So the spleen is an immune organ. Okay, it helps deal with infections. So B cells, T cells with infection, but it also it kind of filters the blood. So it holds a lot of blood. What else do we know about the spleen? It's a solid organ. What do we know about solid organs? They bleed a lot.
Bleed a lot.
All right, let's come back to spleen for a minute. What are the solid organs?
Your aclops.
Okay, which one of you said that?
Me.
Billy? Okay,
Yeah.
so what is aclops?
Your adrenals, kidneys, liver, ovaries, pancreas, and spleen.
Nice. All of these organs are solid organs. They bleed a lot. Okay. So if you damage any one of these, you can have, so let's say you have a splenic laceration due to trauma. This could definitely cause massive internal bleeding and send them into hypovolemic or hemorrhagic shock. Okay. Who else has a spleen that gets big? So this spleen can get filled with blood because it naturally has blood in it. It normally has blood in it. But let's say you get a whole bunch of blood, the spleen gets bigger. What's the word for spleen getting bigger? So big spleen equals splenomegaly. Megaly means enlargement of, so splenomegaly is enlarged spleen. What is hepatomegaly? Hepato means liver. So hepatomegaly is
enlarged liver.
Enlarged liver. Okay, so splenomegaly. Who is the patient who gets this, though? Who is the patient who's likely to have a ruptured spleen?
Like
So
besides
it could be trauma.
Yeah.
Say it again.
I was gonna say besides like a trauma patient.
Trauma. And who else?
I don't know why, but like drug abusers are coming to mind for some reason.
That can, that could, like IV drug users could be a situation. That's probably less common. What's more common is a viral infection. So who else gets splenomegaly? A viral infection. And what virus? This is going to be cytomegalovirus. That's going to be the virus that causes the infection mononucleosis. So the kissing disease. Okay, or somebody drinking water behind somebody else. They get a viral infection, cytomegalovirus. That virus causes the infection, mononucleosis. So you have like a teenage kid who has mono from drinking behind somebody, or it's called the kissing thing, just from transport through saliva. So let's go over that again. Big spleen. Splenomegaly could be caused by a viral infection from cytomegalovirus. That's the virus that causes mono. Who gets it? Sharing saliva, drinking water, kissing, things like that. Okay. Who else can get this? A ruptured spleen could be primarily trauma, some kind of high velocity or high mechanism of injury trauma could cause that. Okay. Who is this patient with cholecystitis or cholelithiasis?
Fatty foods.
Fatty
Deep fried
foods.
fatty foods, recent pregnancy, things like that. Or they're on certain cholesterol medications that actually predispose them to gallstones. Okay. What about pancreatitis? Who's our patient there?
Obesity.
Okay. Obesity, high estrogen count, alcohol abuse. Oh, the other thing is calcification. So excess calcium. So that would be hypercalcemia is how I should say it. Hypercalcemia. Okay. Who has hypercalcemia? Who is the patient who develops hypercalcemia? This is going to be
dialysis, like kidney disease and things like that.
Some kind of kidney failure, also cancer. Some kind of chronic illness or cancer can lead to hypercalcemia. Hypercalcemia can lead to pancreatitis. Okay. And the reason I'm saying this is it's important to know sometimes who is the patient who's likely to have one of these things. Okay. Another example,